Does the gentleman from Michigan seek
Mr. Speaker, pursuant to House Resolution 322, I call up the bill H.R. 2009 to keep the IRS off your Health Care Act of 2013 and ask for its immediate consideration.
The clerk will report the title of the bill.
H.R. 2009, a bill to prohibit the Secretary of the Treasury from enforcing the Patient Protection and Affordable Care Act and the Health Care and Education Reconciliation Act of 2010.
Pursuant to House Resolution 322, the bill is considered read. Gentleman from Michigan, Mr. Camp, and the gentleman from Michigan, Mr. Levin. Each will control 30 minutes. The chair recognizes the gentleman from Michigan, Mr. Camp.
Mr. Speaker, I ask unanimous consent that all members have 5 legislative days in which to revise and extend their remarks and to include extraneous material on H.R. 2009.
Without objection.
And, Mr. Speaker, I yield myself such time as I may consume.
The gentleman is recognized.
Mr. Speaker, I come to the floor today in support of H.R. 2009, legislation that will prevent the IRS from getting involved in Americans' health care. The IRS is already out of control, abusing its power to tax and audit the activities of honest, hardworking Americans. The IRS has betrayed the trust of the American people. Yet Obamacare granted the IRS 47 new powers, including giving confidential taxpayer information to other departments and applying new taxes and penalties. Well before the IRS started getting involved in your health care and sharing your information and forcing people to pay even more taxes, let's first look at the job the IRS is already doing. Back in 2011, I investigated claims that the IRS was threatening donors to conservative causes with higher taxes. It turned out to be true. The IRS was abusing its authority and it was harassing conservatives. But that was just the tip of the iceberg. We soon learned of more accusations about how the IRS was targeting Americans for their political beliefs. What we have found so far, and we just have 3% of the documents from the IRS we've requested, and what we have found is that the IRS did leak confidential taxpayer information. They did delay applications of groups supporting conservative causes, and they did threaten conservatives with higher taxes. And Democrats want to give this agency more power and authority? They want this agency involved in Americans' health care? No way. Even the agency's own watchdog says the IRS cannot handle the job. Less than 2 weeks ago, the independent Treasury Inspector General stated that they're not confident about the IRS's ability to protect confidential taxpayer information or to prevent fraud. Well, neither am I. And by every indication, neither are the American people. It's been 3 years since a health care law was passed, and in less than 2 months, the administration claims it will be fully ready to implement the law. But in the face of all these failures, all these breaches of the public trust, more Americans than ever want this law to be repealed. Why? And it's simple. Obamacare has brought increased health care costs to families and individuals, has stifled businesses from expanding, and forced American job creators to cut jobs, wages, and hours. Just yesterday, at a hearing in the Ways and Means Committee, a key official from Health and Human Services could not confirm that the health care law would lower the health care costs for hardworking families in my home state of Michigan. But wasn't this the signature promise of this administration? That premiums would be $2,500 lower? And now the administration cannot make good on that promise. With so little time before the exchanges are set to open and families have families to plan their health care spending for the next year, it's extremely concerning that the administration cannot tell the American people what their health insurance will look like or what it will cost. Simply put, this law is a failure and ought to be repealed. But it didn't have to be this way. The House Republican alternative to the Democrats' health care law, which I authored, was the only legislation scored by the nonpartisan Congressional Budget Office as meeting the top health priority of American families, because it was the only bill that actually lowered the cost of health insurance premiums. And it didn't give the IRS a single new power. It kept the IRS out of your health care. which is exactly what this bill will do. Keep the IRS off and out of your health care. We should be cutting the IRS, not expanding it. We should reduce its power and authority and its ability to harass and abuse Americans. That's exactly what this bill does. I urge my colleagues to join me in voting yes on this legislation.
Gentleman's time is reserved. Gentleman from Michigan, Mr. Levin.
I yield myself such time as I shall consume.
Gentleman is recognized.
We're now 7 months into this House Republican session. It has been nothing more than a bridge to nowhere. Nowhere on jobs, nowhere on immigration reform, nowhere on a budget agreement, and nowhere on most appropriation bills. Instead, House Republicans today continue their obsession, so vividly embraced by the chairman of our committee in his words, with trying to destroy the bridge built by the President and the Democratic Congress to somewhere vital, putting all Americans in charge of their own health care. This bill before us is nothing more than a continuation of Republicans' blind obsession with repealing the Affordable Care Act. This is how Republicans have chosen to spend the last day here before recess for 5 weeks. Well, it's so clear. The Republican mission is to destroy, not implement health care reform. And rather than help leading on the issue, House Republicans have spent the last 2+ years trying to mislead Americans about health care rights under ACA. And now we can expect more misinformation, and the statement of our chairman is loaded with it. 13 states, for example, have published preliminary premiums for marketplace coverage. Within those states, Americans will be able to purchase insurance at a price that is on average 20% below what the CBO estimated. And in Michigan, there'll be 14 insurance carriers in the marketplace. And someone comes up here and says health care reform is failing. So to the American people, be prepared for more scare tactics and other misguided efforts from Republicans to convince constituents that applying for health care coverage will be time-consuming and cumbersome. And be prepared for all kinds of misstatements about the powers and the role of the IRS. This should be said categorically. Neither the IRS nor the Department of Health and Human Services will have access to medical records or other personal history. No access whatsoever. I reserve the balance of my time.
Gentleman's time is reserved. Gentleman from Michigan, Mr. Camp.
Thank you, Mr. Speaker. At this time, I yield such time as he may consume to the distinguished member of the Ways and Means Committee, the gentleman from Georgia, Dr. Price, and I also ask unanimous consent that the gentleman from Georgia control the remainder of my time.
Without objection.
Of the time. Thank you. Gentleman
from Georgia is recognized.
Thank you so much. I want to commend the chairman for his work on this and so many vital areas of the issue of health care in our committee, and I want to thank him for the time and the opportunity to bring this bill forward. Mr. Speaker, Republicans' goal in health care is to make certain that we have the highest quality health care in the world. That's our desire. We simply want it to be patient-centered health care, not government-centered health care. We believe that patients and families and doctors ought to be making medical decisions, not Washington, D.C. So this bill, H.R. 2009, grows out of the IRS activities that have come to light in this country over the past number of months. And as the chairman mentioned, we've been doing a lot of oversight hearings in our committee. The American people, Mr. Speaker, have drawn a conclusion about the IRS at this point. And that conclusion is that it cannot be trusted now. The chairman mentioned the IRS has targeted groups that came to the IRS asking for tax-exempt status, targeting groups for their political ideology. The IRS has leaked donor information to those groups. And many of us believe, and I think it will come out, that the IRS has in fact targeted donors to those groups for audits to those individual Americans. Mr. Speaker, this is chilling activity from the Internal Revenue Service. So the American people have lost their faith and trust in the Internal Revenue Service. That's why this bill is so important. This is a very simple piece of legislation, 2 pages, in fact. And all it says simply is what the American people believe, and that is that the IRS should not be charged and have the authority to either implement or enforce the Affordable Care Act. Over 140 co-sponsors from this House of Representatives. I want to commend them for being co-sponsors. And we have hundreds of citizen co-sponsors from across the country. Now, some say that this isn't necessary, that it's not going to accomplish anything, that there's no reason why the IRS would want that information anyway. Fact of the matter is, Mr. Speaker, that's exactly what they said about what they did for the tax-exempt groups. They said, well, it wasn't necessary for them to get that information about political ideology or belief or prayers that prayer groups were offering. That wasn't necessary either. So if that wasn't necessary, Mr. Speaker, how can the American people have faith and confidence that the IRS won't do something that also is unnecessary, and that is to engage in implementing themselves into that trusted relationship between patients and physicians? And then another piece of evidence, Mr. Speaker, I would suggest is the individual who's running the IRS division that is charged with the enforcement of the Affordable Care Act. That individual, Mr. Speaker, Sarah Hall Ingram. Don't have to look too far back in her biography to recognize that she was the individual who was, in fact, in charge of the tax-exempt group in the IRS at the time when the challenges to the IRS have been focused. So, Mr. Speaker, the overwhelming percent of the American people understand and appreciate that the IRS should not be involved in the health care of this nation. We believe patients and families and doctors ought to be making medical decisions, not Washington, D.C., and certainly not the Internal Revenue Service. And I reserve the balance of my time.
Gentleman's time is reserved. Gentleman from Michigan.
I now yield 2 minutes to another member of our committee, Mr. McDermott of Washington.
Gentleman from Washington is recognized for 2 minutes. Without objection.
Mr. Speaker, I would remind my distinguished colleague from Georgia of a story in the Bible about a king who was very famous, and one day he noticed on the wall some writing. And he had someone come in and interpret for him, and the writing said, "Your days are numbered upon the earth." Now, your days are numbered on this issue. You have 59 more days. I'm sure you can bring up a bill every single day to try and repeal it. The Speaker's announced there'll be 2 more. But it will not work. This is going to be the law on 1 October, and it's going to go into effect. The Supreme Court has spoken. The Speaker's actually said it's the law of the land. And yet we see this hopeless strategy. And it's worse than hopeless. It's weak and it's mean. Because what you're saying is you want to take away from people what they already have. Guaranteed issue, coverage for their kids to age 26, and lifetime limits are gone. All of that you want to take away. Now, have a great break, because you're going to go back to your districts and explain for 30 or 38 days why you will not provide health care coverage for the people of America. I hear there's a bill, a mythical bill, with 141 signatures. The Republicans have been running the Ways and Means Committee for 16 out of the last 18 years, and we have never had a bill put in front of us for a vote. It's never been through the Rules Committee. It's never been out to the floor. You have no plan. You have a piece of paper that you wave around, but you won't go out and defend it. The President came and put a bill out here, and we passed it, and we're defending it, and it's going to go into effect and provide what all Americans want: security if they get sick. They want to know they'll be covered. They want to know they won't be bankrupted. Vote no again today, and we'll be back after the break for a few more no votes.
Gentleman's time has expired. Members are also advised to direct their comments to the chair, respectfully. Gentleman from Georgia.
Thank you, Mr. Speaker. I ask unanimous consent that a letter from the Senior Coalition in support of H.R. 2009 be inserted into the record.
Without objection.
I'm pleased to yield a minute and a half to the gentleman from Texas, Mr. Carter.
Gentleman from Texas recognized for 90 seconds.
I thank the gentleman for yielding, and I thank him for bringing forward this bill. I'd be willing to bet if you took a poll in any household in America and said, who do you trust, the IRS or your doctor? Doctors would overwhelmingly be trusted. IRS would be overwhelmingly distrusted. I don't understand when we actually pass laws in this Congress restricting the access to health care information and putting severe penalties on our health care providers for releasing health care information. And these HIPAA laws, and they've been around for a while now, I'd say. But then we write a bill that turns the entire healthcare systems administration over to the one agency that the American people hate more than any other agency. Now, some of the Democrats like it because they like to get other people's money and spend it. But the reality is the IRS is not trusted, wasn't trusted before the events that have been described here today. Today they are totally distrusted. In fact, they are totally feared by what they can do to the private lives of American citizens. This bill speaks for the American people, and they say, don't let the IRS get their hands on our health care. They will destroy us. Remember, they're the one agency that doesn't have to meet a burden of proof. They require the public to meet the burden of proof. Don't let the IRS get their hands on our health care. Yield back.
Gentleman's time has expired. Gentleman from Michigan.
I yield myself 15 seconds.
Gentleman is recognized for 15 seconds.
Saying that the entire administration of health care is turned to the IRS is a big lie. It's a big lie. The IRS will not have access to the medical records or personal health history of a single American. I now yield 2 minutes to the distinguished colleague of mine from Oregon, Mr. Blumenauer.
Gentleman from Oregon is recognized for 2 minutes.
Thank you, Mr. Speaker. This is a fitting conclusion to a week that has shown the collapse of the Republican legislative agenda. Remember, this is the time we were supposed to be voting on budgets. But the Republicans cannot even bring themselves to allow a vote on the budget that they themselves have mandated. And so we're not voting on the transportation and HUD. We're not voting on Interior. They refuse to allow a conference committee to be appointed so that we can reconcile differences on the budget, setting up a showdown over a shutdown of the government next month. And now we're dealing with health care for arguably the 40th time that they are going to, quote, repeal it. The bill's not going anywhere. They have repeatedly demonstrated at our hearing yesterday in Ways and Means that my Republican colleagues don't even understand how the bill that they are so adamantly opposed to, they don't even understand how it works. We have not seen any attempt to improve, to refine. What we have seen is an unprecedented effort to sabotage legislation, to make it not work for the American people, to confuse, to undercut, something that is unprecedented, to the best of my knowledge, in what we had in the Congress in the past. But what more fitting illustration of a group that's bankrupt of ideas and bent on simply attempting to force their way for an agenda that is so extreme that they cannot agree to bring it to the floor to vote on it. I urge rejection of this charade.
Gentleman from Georgia.
Thank you, Mr. Speaker. Mr. Speaker, I ask unanimous consent that a letter from the group Let Freedom Ring endorsing H.R. 2009 be inserted into the record.
Without objection.
Mr. Speaker, I'm pleased to yield a minute and a half to a fellow physician, member from the great state of Michigan, Dr. Benishek.
Gentleman from Michigan is recognized for 90 seconds.
Thank you. Mr. Speaker, I rise today in support of H.R. 2009, the Keep the IRS Off Your Health Care Act, and urge my colleagues to support this necessary legislation. The bill will keep the Internal Revenue Service from implementing any aspect of the President's health care law. With the recent revelations that employees of the IRS targeted U.S. citizens based on their political views, it's imperative that we keep the IRS from being further involved than it already is in the lives of the American people. This legislation would repeal both the individual mandate and the employer mandate, while at the same time helping to shrink the IRS. As a doctor, I've been taking care of patients for the last 30 years. I know that putting the federal government between patients and doctors will be disastrous. Many families in northern Michigan agree, and they want to see this law repealed. This legislation is a good step toward rolling back this massive expansion of federal government power. I am proud to be a co-sponsor of this legislation and urge all of my colleagues to join me in voting in favor of it. I yield back the balance of my time.
Gentleman yields back his time. Gentleman from Michigan.
It's now a special pleasure for me to yield to the gentleman who presided over the passage of Medicare 48 years ago and has worked on health care issues his entire historic career, Mr. Dingell from the state of Michigan.
Gentleman from Michigan is recognized.
For a minute and a half. For a minute and a half.
Gentleman is recognized for 1.5 minutes and without objection.
I thank my beloved friend for yielding me this time, Mr. Speaker. And I rise to ask, aren't you embarrassed to go a 40th time in a fruitless, hopeless act? This is the 40th time we've tried to kill the legislation. Costs us $1.5 million every time, and none of which has been successful. My Republican colleagues have never come forward with a proposal which they have presented to this House, but they sit over there railing and complaining about what is going on. They're going to take the rights of the American people for protection against pre-existing condition bans of their insurance. They're going to take away from the American people all kinds of protections which we have in the Affordable Care Act. The Speaker the other day said the Republicans were the party of repeal. I think he's right. I suspect we don't want to call them the Republicans anymore, but I think we ought to call them the Repealicans, or perhaps the Repealicants, because they've never been able to repeal anything, and they can't enact legislation. 12 bills, I think, that this Congress has sent to the White House, and there is small prospect of anything more coming from here. It's interesting to note they can't move a budget. They can't do legislation on jobs. They're incapable of seeing to it that we do the other things that are necessary to help the middle class. And yet we keep coming over here with nonsense like this. The Republican Party is like the Bourbons of France. They forget nothing because they never learned anything.
Gentleman's time has expired. Gentleman from Georgia.
Thank you, Mr. Speaker. I ask unanimous consent that a letter from the group Americans for Prosperity endorsing H.R. 2009 be inserted in the record.
Without objection.
Mr. Speaker, I'm pleased to yield a minute and a half to a gentleman who's a member of the Appropriations Committee, a fellow who has led on this issue for his entire career, the gentleman from Texas, Mr. Culberson.
Gentleman from Texas is recognized for 1.5 minutes.
Thank you, Mr. Speaker, and I appreciate very much the gentleman from Georgia filing this important legislation. I feel my day is not complete if we don't get a chance to vote to cut spending and abolish Obamacare. We were sent here by our constituents to protect the Treasury and do everything we can to keep the government out of their lives and out of their pockets. Yet Obamacare contains more than 20 tax increases and gives the IRS unprecedented authority to collect personal health information from more than 300 million Americans. Obamacare requires all insurance companies to report to the IRS the name, address, identification number, and type of insurance policy purchased by every customer, along with a determination of whether or not the insurance was, quote, government approved. I'm very proud to be a co-author of Dr. Price's legislation that will prohibit the IRS from collecting our personal health care information. The IRS has proven they cannot be trusted by targeting organizations based on their political affiliation. Now, since the IRS has admitted this, I've heard from so many constituents who are members of patriotic organizations. They stepped up for the first time in their lives to get involved in politics and organizations like the Texas Tea Party, the Katy Tea Party, the King Street Patriots, and for their for standing up as patriots and trying to do the right thing for the right reasons. They were targeted by the IRS and harassed. Today, the IRS is spending 80% of its budget trying to implement Obamacare. And Treasury Secretary Jack Lew recently testified the IRS has approximately 700 full-time staff working on Obamacare implementation. And now the IRS wants to hire an additional 2,000 bureaucrats to continue to implement Obamacare. I urge my colleagues to support this important bill, and I yield back the balance of my time.
Gentleman from Michigan.
I now yield 2 minutes to a gentleman from New Jersey who has been a leader on this issue, Mr. Andrews.
Gentleman from New Jersey is recognized for 2 minutes.
I ask unanimous consent to revise and extend my remarks.
Without objection. Gentleman is recognized.
Thank you. Colleagues, somewhere in America today, a family's going to get the devastating news you all dread about your children. They're going to hear that that lump in their daughter's stomach is cancer. And they're going to go home and they're going to have all the agony and all the suffering and all the unthinkable thoughts that parents would have in that situation. But they're going to be faced with another problem because they have no health insurance. Both the mom and the dad work. They make about $40,000 a year between the two of them. They don't get coverage at work and they can't afford health insurance. So their agony is not just worried about the health of their child. They're worried about the fact that if they give the child the care that she needs, they'll lose everything they have and wind up in bankruptcy court. The Affordable Care Act says to that couple that starting January 1st, for about $40 a week, they can have health insurance coverage as good as members of Congress do. That's what the Affordable Care Act says. This bill repeals that for that family. Those who are prepared to vote for this bill should also be prepared to answer the following question. If you want to say to that family that their concern isn't important enough, what's your plan? What's your answer to them? Now, we'll hear that people have introduced bills and sent around letters. Here's the facts. It's been almost 1,000 days that the Republican Party has been back in control of the House of Representatives. The number of bills they have voted on to replace this law is zero. Zero. 40 times to repeal it, 0 times to replace it. This debate is not about Republicans and Democrats. It's about that family with that daughter that has no health insurance if you repeal this law and pass this bill. This is no plan. This is no responsibility, and this is no way to deal with the concerns of middle-class Americans. Vote no.
Time of the gentleman has expired. The gentleman from Georgia.
Thank you, Mr. Speaker. I ask unanimous consent to insert into the record a letter of support for H.R. 2009 from the organization Restore America's Voice.
Without objection, it will be part of the record.
Mr. Speaker, I'm pleased to yield 1 minute to the Majority Leader of the House of Representatives, the gentleman from Virginia, Mr. Cantor.
The gentleman from Virginia, the Majority Leader, is recognized for 1 minute.
Mr. Speaker, thank you. I thank the gentleman from Georgia. And Mr. Speaker, I rise today to support the Keep the IRS Off Your Health Care Act. And I want to congratulate the gentleman from Georgia and his leadership in bringing this bill to the floor. I think not only a timely bill, but a bill that is essential to the health and well-being of all Americans. And Mr. Speaker, in response to the gentleman's assertions, the prior gentleman that spoke from New Jersey, I would simply say those scare tactics do not have a place in legitimate debate on this floor. Scare tactics to say that somehow Republicans on our side of the aisle don't care about people's health care is just not true. You know, we don't believe in omnibus Washington engineered health care. That's what's going on here. Washington bureaucrats deciding what kind of health care you can have, which doctors you can see, how much those doctors and hospitals are going to get paid, how the insurance companies have to act. All of that is in the hands of Washington bureaucrats under Obamacare, which is why this bill and this law is suffering so much in terms of the minds of the public. This is not the right way to go. We believe in patient-centered care. Republicans believe that it ought to be about the doctor-patient relationship, not between the bureaucrats and the doctors. It ought not be about the bureaucrats and the insurance companies. It ought to start with the patients and their families. So these scare tactics really, Mr. Speaker, are not relevant to this discussion, and they are just that, scare tactics. We care about the health and well-being of the American people, which is why this bill is coming to the floor. Now, recently, Mr. Speaker, we've learned that the IRS has been abusing its power by targeting and punishing American citizens for their political beliefs, and then recklessly spending taxpayer dollars on lavish conferences and bonuses for its employees. This kind of government abuse must stop. The last thing we should do now is to allow the IRS to play such a central role in our health care. The IRS has a role in nearly 50 different aspects of Obamacare. The agency's involvement is so extensive that there is a designated office within the IRS just to implement Obamacare. The IRS will have access to the American people's protected health care information. Given that this same agency has illegally disclosed protected taxpayer information, the privacy concerns raised by many are legitimate. This is nothing short of an unwelcome big government overreach into the most personal aspect of our lives. Obamacare is bad for the economy and for working middle-class families. It increases costs, impedes innovation, and we know is now turning full-time jobs into part-time jobs, which is why so many on both sides of the political spectrum are now beginning to realize, in the words of 3 Democratic union leaders, that this law is creating nightmare scenarios in the health and well-being of millions of hardworking Americans. The legislation before us today will at least prevent the unnecessary intrusion of the IRS into our health care. Members of both parties should be focused on removing the federal bureaucracy from the everyday lives of the American people, and this act will do just that. Again, I'd like to thank the gentleman from Georgia, Dr. Price, for his hard work on this issue, and I strongly urge my colleagues to support this bill. Thank you.
Time of the gentleman has expired. The gentleman from Michigan.
I now yield 2 minutes to another distinguished member of our committee, Mr. Doggett of Texas.
The gentleman from Texas is recognized for 2 minutes.
The majority leader is absolutely right about scare tactics. If you are an uninsured American and you get a diagnosis of cancer this morning, or you're hit in a head-on collision this afternoon, or you have a child born with a disability, you ought to be very scared. He's also absolutely right about the need for patient-centered health care. We're concerned about that. We're concerned that patients without insurance today are centered. They're centered right in the bankruptcy court. More and more Americans faced with a health care crisis. This bill has nothing to do with the Internal Revenue Service or the Treasury Department or restricting their rights. It's about restricting your rights. Now that we finally have a chance to protect Americans from insurance monopoly price gouging, from fine print in the contract for those who do have insurance that denies rights at the very time that you need them the most. That kind of protection about to go into effect, along with the right of so many Americans who are uninsured to go to a competitive private insurance marketplace and pick the policy that is best for their family. And for many Americans to have a premium tax credit, a tax credit that they want to deny to you. And what alternative do they offer? Well, the best source is the official Republican website. I urge you, though you'll find plenty of misinformation there, to go to GOP.gov, because you'll find one very revealing fact. When you look there to see what the Republicans have to offer as an alternative to Obamacare, it says two words: in progress. It's been in progress since 2.5 years ago when they voted the first time to repeal Obamacare, right up to today when they vote for the 40th time to do it. They have only one alternative to Obamacare, and it's called nothing care. It's called do nothing but allow these insurance monopolies to continue to deny rights to our people. The folks I represent from San Antonio to
Time
Austin,
the gentleman has
do you
expired.
have another 15
Just
seconds?
15 seconds.
The folks
Gentleman's
that I
recognized for
represent,
15
the
seconds.
working families from San Antonio to Austin, they deserve to have some assistance. We have provided it to them with guaranteed rights. Some are in effect now, some about to go into effect. Don't let these Republicans deny those rights to our families and replace it with nothing care. I yield back.
Time of the gentleman has expired. The gentleman from Georgia.
Thank you, Mr. Speaker. I ask unanimous consent that a letter endorsing and supporting H.R. 2009 from the group Freedom Works be inserted into the record.
Without objection, it will be part of the record.
Pleased to yield a minute and a half to a fellow member of the Ways and Means Committee, the gentleman from Minnesota, Mr. Paulson.
Gentleman from Minnesota is recognized for 1.5 minutes.
Thank the gentleman for yielding. Mr. Speaker, the health decisions of individual Americans should be made between patients and their doctors. The internal revenues should not be a part of that equation. Now, we all know, all Americans know now, that the IRS has inappropriately used its authority to target and intimidate certain individuals and organizations based on their personal beliefs. 2,000 more IRS agents, more Washington bureaucrats are in opening the door, will open the door now to more abuse under Obamacare, more targeting, more harassment of American citizens. Physicians know the best care for their patients, not unelected bureaucrats in Washington. We should be encouraging patients to take control of their own health care through consumer-directed health care plans, not ceding control to the government. I would encourage my colleagues to support this legislation, protect the doctor-patient relationship, and do what is needed to make sure that government overreach is not involved in American health care. I yield back the balance.
The gentleman yields back his time. The gentleman from Michigan.
It's now my pleasure to yield 3 minutes to our whip, Mr. Hoyer of Maryland, who's devoted so much time to health care in his career.
The
3 minutes.
gentleman from Maryland, the whip is recognized for 3 minutes.
I thank the gentleman for yielding. What a perfect bill this is. Our Republican friends don't like taxes. They don't like the collection of taxes. And, of course, none of us do. And they don't like affordable care for our citizens, quality care for our citizens, accessible care for our citizens. So with this stroke, they can attack both. The gentleman that just spoke asserts that the American people know. The Republicans have made an assertion about the oversight of taxpayers to see whether or not they're committing fraud, i.e. claiming to be social welfare organizations, when everybody in America knows they are solely political organizations. And the Republicans never mentioned it was across the board, not targeted. And the Affordable Care Act, they don't like that either. They would, as my friend from Texas says, still like to have the insurance companies in charge. Not the patient, not the doctor, but the insurance companies. Mr. Speaker, less than 2 weeks ago, Republicans were on this floor for the 38th and 39th time to repeal the Affordable Care Act, the Accessible Care Act, the Quality Care Act. Now we have the 40th time we've been at this. The American people, of course, want to see us working on jobs. They want to see us working on investment and education. They want to see us being able to compete with the world. But what do? We continue to beat this horse. And contrary to my Republican friend's assertion, Americans say overwhelmingly, when asked, do you want repeal or do you want a fix, make it better, do things better, make it more efficient, they opt for the latter, overwhelmingly. But as the gentleman from Texas just said, you go to the website, and that's 2.5 years. Not 2.5 years, I tell my friend from Texas. It's been 7 years since 2006 when we started working on this. But there's no fix. No fix on the website, no fix on this floor. Today, their newfound populism is nowhere to be seen as they vote to repeal tax credits and subsidies designed to make health care more affordable for those same people, working families and small business, who haven't been able to get insurance and are left at risk without the security of it. Suddenly, the party that never met a tax break it didn't like is pursuing a tax increase of more than $1 trillion on small businesses and the middle class. As a result, they are making health care more expensive, and millions of Americans will no longer be able to access affordable health care. One more minute.
How about an additional 30 seconds?
30 seconds.
Gentleman recognized for 30 seconds.
Mr. Speaker, this bill makes all those folks pawns in Republicans' single-focused quest to undo health care reform at the expense of every other pressing challenge we face as a nation. It's shameful, Mr. Speaker, that this House continues to waste the American people's time on health care repeal votes that won't go anywhere, and they know it. The Senate will not pass this bill, and the President will not sign it. We have pressing business before us that needs immediate attention. Finishing appropriation bills, completing our work on the budget, provides a balanced alternative to the sequester, ensuring America can pay its bills, and taking action to create jobs. That's what we ought to be doing, not this continued foolishness, and I yield back the balance of my time.
Time of the gentleman has expired. The gentleman from Georgia.
Thank you, Mr. Speaker. May I inquire as to the time remaining on each side?
The gentleman from Georgia has 13 and a half. The gentleman from Georgia has 16 minutes remaining, and the gentleman from Michigan has 13 and a half minutes remaining.
Thank you, Mr. Speaker. I'm pleased to yield a minute and a half to a freshman member from the great state of Oklahoma, Mr. Bridenstine.
The gentleman from Oklahoma is recognized for 1.5 minutes.
Thank you, Mr. Speaker. It is interesting that the minority whip would like Republicans to help in fixing this bill, considering that they weren't interested at all in Republican input when they passed it in the middle of the night with a pure party line vote. I think everybody understands that the promise of Obamacare has been thoroughly discredited, but the worst is yet to come. The authors of the bill promised that it would bring down the cost of health care, but premiums have gone up substantially. They promised that if you like your health care plan and the doctor you have, you can keep it. Now, when you go to the President's healthcare.gov website, it says that, quote, depending on the plan you choose in the marketplace, you may be able to keep your current doctor. Many supporters promised that the bill would actually create jobs, but even Teamsters Union President James Hoffa has now said that the bill will destroy the foundation of the 40-hour work week. A small group of members in 2010, led by former Congressman Bart Stupak, had the chance to inviolably prohibit any funds in Obamacare from being used to pay for abortions or abortion-inducing drugs. Unfortunately, they caved. And now companies like Hobby Lobby are being forced into court to prevent Obamacare from requiring that they provide health care services which directly violate their conscience and their religious principles, values and rights that are enshrined in the First Amendment. The IRS, too, has irrefutably proven the political nature and intimidation tactics of the work it performs every day, an attitude that will, beyond a shadow of a doubt, carry over into its tag team partnership with HHS in enforcing Obamacare. Let's pass H.R. 2009 and start putting a stop to this madness before it gets even worse. I yield back.
Time of the gentleman has expired. The gentleman from Michigan.
I yield 2 minutes to another distinguished member of our committee, Mr. Kind of Wisconsin.
The gentleman from Wisconsin is recognized for 2 minutes.
Thank you, Mr. Speaker. I thank my friend from Michigan for yielding. And, Mr. Speaker, what turned out to be a silly exercise has suddenly turned into an insane exercise. We find ourselves for the 40th time in the House of Representatives debating repeal of the Affordable Care Act. We understand they don't like it, but I beseech my colleagues on the other side to start working with us to improve a system that's in desperate need of reform and make changes and adjustments along the way as we learn what's working and what isn't. It's the only way this can work. But let me just inject a few facts in this debate, especially for the benefit of the previous speaker, that since the passage of the Affordable Care Act, U.S. healthcare spending grew at 3.9% for the last 3 years, the lowest growth rate in over 50 years. Medicare per beneficiary spending rose just 0.4% last year, the lowest rate since it was created in '65. Medicaid per beneficiary spending dropped by 1.9% in 2012. And according to the Congressional Budget Office, Medicare and Medicaid will now spend $1 trillion less over the next 10 years than previously projected. Nearly $15 billion in fraudulent Medicare payments have been recovered and recaptured under the Affordable Care Act. Hospital readmissions under Medicare have fallen for the first time on record, resulting in 70,000 fewer readmissions in the second half of last year alone. And more than 250 new accountable care organizations under the Affordable Care Act, serving over 4 million Medicare beneficiary enrollees, are getting paid now according to the quality of health care being delivered and no longer the quantity of services being rendered. And finally, the growth in private plan premiums has also slowed, Mr. Speaker. Annual premiums for employer-sponsored family health care increased by only 4% in 2012, the smallest increase in the last 13 years. We still have more work to do. But this debate and effort to delay and to defund and to dismantle and to destroy the Affordable Care Act is not where we need to go as a nation. And I encourage my colleagues to once again vote no on this ill-conceived legislation. I yield back the remainder of my time.
The time of the gentleman has expired. The gentleman from Georgia.
Thank you, Mr. Speaker. I appreciate the comments from my friend from Wisconsin and his chastising us for voting to repeal or change portions of the Affordable Care Act is curious in light of the fact that the gentleman himself, I believe, supported one of our efforts just 2 weeks ago on delaying the employer mandate. So hope springs eternal that he'll be able to can support our efforts in this endeavor on H.R. 2009, and I reserve the balance of my time.
The gentleman from Georgia reserves his time. The gentleman from Michigan.
I now yield a minute and a half to another distinguished member of our committee, Mr. Thompson of California.
The gentleman from California is recognized for 1.5 minutes.
I thank the gentleman for yielding, and I rise in opposition to this misnamed piece of legislation. It actually should be called the 40th time we've wasted the Taxpayers' Time and Money Act. This is a bill that's not new to us. We've seen it before. We've seen this movie before, 39 times as a matter of fact, and we know how it ends. This is just another attempt to dismantle the Affordable Care Act, and we've wasted too much time and too much money on this already. What we should be doing is working to make the ACA better or spending our time trying to help pass some jobs legislation. This bill is particularly cruel because it hits the poorest among us the hardest, and we've seen that movie before also. And we saw it play out. That's why we have this piece of legislation. This is in response to a national crisis. This just didn't come about by itself. Hospitals and doctors and clinics in all of our districts, they provided $100 billion a year in uncompensated care. Families were one layoff away from not having access to health care. People with pre-existing conditions that occurred through no fault of their own. Maybe they had a bad luck with having cancer or gave birth through a C-section, a pre-existing condition, and they could not get coverage. People in all of our districts were hitting the lifetime cap on their health care. This was no accident. It was in response to a crisis. Let's get to work. Let's get this thing improved. Let's put people back to work and stop messing around with this foolishness. I yield back the balance of my time.
The gentleman has expired. The gentleman from Georgia.
Thank you, Mr. Speaker. I ask unanimous consent that a letter in support of H.R. 2009 from the Americans for Tax Reform be inserted into the record.
Without objection, it will be part of the record.
I reserve the balance of my time.
The gentleman reserves. The gentleman from Michigan.
I now yield a minute and a half to another member of our committee, the gentleman from New York, Mr. Crowley.
The gentleman from New York is recognized for 1.5 minutes.
Mr. Speaker, I rise in support of in support of America's working families and against this bill. I'm just baffled as to why we would take away a tax credits that help working families for the first time in many instances afford insurance, particularly as this majority seems to have never met a tax break they didn't like. Well, at least not until today. Time after time, the Republican majority defends special interest breaks, tax breaks provided to owners of corporate jets, subsidies for big oil, tax write-offs for big corporations, even as they're laying off American workers and moving more of their operations overseas. But where is that same zeal today in defending tax cuts for middle-class Americans? Maybe I shouldn't be surprised. After all, this majority has repeatedly tried to undermine this tax credit since its inception. They've even sought to require hardworking Americans to pay the entire credit back if they get a slight increase in pay or a bonus for good work. My colleagues, the majority has crossed some bizarre threshold today, going from principled opposition to dangerous obsession. Now, I know some Republicans will say they're doing this because they have issues with the IRS. Should we expect a bill on the floor when we come back after the August break to stop the IRS from sending people their income tax refunds? No, because this is just an excuse they're using. This bill is 100% about denying Americans access to affordable health care. In New York, 1.5 million people will be denied tax credits if this bill is enacted.
Seconds.
My colleagues, I am tired of this dog and pony show. Yes, members return to their districts for a few weeks, but political red meat is not what this country needs. We need a Congress with a vision for tomorrow, a vision focused on creating jobs and strengthening our economy, not a 40th vote on a new, even more dangerous way to repeal the Affordable Care Act. And with that, I yield back the balance of my time.
Time of the gentleman has expired. The gentleman from Georgia.
Thank you, Mr. Speaker. I ask unanimous consent to include into the record a letter endorsing H.R. 2009 from a group of 6 taxpayer advocate organizations.
Without objection, it will be part of the record.
Reserve the balance of my time.
Gentleman reserves.
Could I ask for the amount of time on both sides, please?
The gentleman from Michigan has 8 minutes remaining. The gentleman from Georgia has 14 minutes remaining.
If I may, Mr. Speaker, gentleman yield?
Yes.
I have other speakers that may be coming, but at this point I have no other
All right,
speakers on the floor.
Let me proceed then. Let me yield.
I am prepared to close at any point.
Okay, we have other speakers. Thank you. I now yield 2 minutes to a distinguished gentlewoman from New York, Ms. Velasquez, who is the ranking on the Small Business Committee. 2 minutes.
The gentlelady from New York is recognized for 2 minutes.
I thank the gentleman for yielding. Mr. Speaker, I rise in opposition to the bill before us today. Sadly, we find ourselves in another redundant and unproductive debate over the Affordable Care Act. The estimated cost of today's vote is over $1 million, paid by hardworking taxpayers. But instead of focusing on jobs and economic growth, we're wasting time and money on denying health coverage to small businesses and their employees. Not even half of the appropriation bills have been passed, and yet Republicans continue their attempts to undermine health reform. This obsession must end. It is time to move on and start tackling the challenges the American people care about: jobs, 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 the economy. Blocking the IRS from implementing provisions of the Affordable Care Act does nothing to help our nation's small businesses. Rather, today's bill will keep small employers from taking advantage of the small business health care tax credit, which has already helped over 360,000 small employers and 2 million workers. This bill prevents these businesses from utilizing the 50% tax credit in the new shop exchanges next year. That is why today's vote is irresponsible and out of touch with American firms. We must continue to ensure quality health coverage is available and utilized by the businesses that are the cornerstone of the American economy. I urge members to vote no. Thank you, and I yield back the balance of my time.
The gentlelady yields back her time. The gentleman from Georgia.
I continue to reserve.
Gentleman reserves. The gentleman from Michigan.
It's now my special privilege to yield 1 minute to the person who led our efforts, and the health care reform is a testimony to her career. The gentlelady from California, our leader.
Gentlelady from California, the minority leader, is recognized for 1 minute.
Thank you, Mr. Speaker. I thank the gentleman for yielding and for his leadership of importance to the American people, the creation of jobs, growing our economy, and in the case of what is on the floor today, the 40th attempt to harm the health and financial well-being of the American people. 40 is a number that is fraught with meaning in the Bible. 40 hours, 40 days, 40 years in the desert. But it's fraught with nothing when it comes to overturning the Affordable Care Act, as they're trying to do for the 40th time today. When our Republican colleagues vote for this bill, they will vote to put insurance companies back in charge of people's health. When they vote for this bill, they will be voting for an initiative that deprives patients of their rights, of making a pre-existing condition a reason for discrimination. That's what a vote for this does. That's the joy of the Affordable Care Act. No longer will being a woman be a pre-existing condition. People with pre-existing condition can no longer be denied coverage. Annual or lifetime limits are eliminated. Insurance companies must spend their money on insurance. That's what people bought. And they must do it in a way that that focuses on health care, not on CEO pay, advertising, and the rest. So 80-20 ratio. Many people in our country have received billions of dollars already because the insurance companies have had to refund policy money because they were spending too much on themselves and not enough on employees, on policy holders. So here we are for the 40th time. What's really sad about it is not only the violence that it does to the health of the American people and to a policy that enables them to have prevention and wellness and about the health of America, not just the health care. What's sad about it is for 40 times we have had an opportunity cost of using the time of this Congress to bring a jobs bill to the floor. A jobs bill that is very needed, a jobs bill that says let's make it in America, manufacture in America, build the infrastructure of America, strengthen our communities with education and public safety and the rest. Instead of that, and instead of even passing appropriations bills, the Republicans are in this aimless path, taking us into chaos as we go into August, because in September, the moment of truth will be here. The fiscal year will end on September 30th. Instead of preparing for that, the Republicans are once again on this fool's errand of making matters worse for the American people, putting insurance companies in charge of people's health, depriving patients of their rights. This budget challenge that we have is a very serious one. We shouldn't even be leaving here today because we haven't done the work necessary to prepare us for the end of the fiscal year. Instead, we are wasting the taxpayers' time and money. I urge our colleagues to vote no on this legislation. I urge the American people to insist that we get down to the people's business of job creation and to find a budget that will not destroy and question the full faith and credit of the United States of America, to find a budget that will create jobs, grow the economy, and reduce the deficit. If we don't, and we shut down government, as some on the Republican side have said, unless we repeal the Affordable Care Act, we're going to shut down government. What does that mean to you? It means to you that your 401k success is in jeopardy. It means that if you have mortgage interest payments, you'll probably pay more. Your credit card bills will probably go up because of the increase in interest. It's just not right for what it does. It does not understand the economic challenges faced by America's families who want jobs, want to educate their children, want to maintain their homes, want to have secure pensions for the future, It's just silliness, and it does not deserve even the time we're taking on the floor, much less rise to the dignity of deserving a vote by members of Congress. With that, I urge a vote no and yield back the balance of my time.
Lady yields back. The gentleman from Georgia reserves his time. The gentleman from Michigan.
Mr. Speaker, it's now my special pleasure. As I think everybody knows, the two committees, Energy and Commerce and Ways and Means, work closely together. And as chairs, Mr. Waxman and I were able to, with others, work so closely. So I now yield, as I said, with special privilege and pleasure, 2 minutes to the gentleman from California, the ranking member on Energy and Commerce, Mr. Waxman.
The gentleman from California is recognized for 2 minutes.
Mr. Speaker, this is a do-nothing Congress. It is absolutely pathetic. There are millions of people unemployed. Are we working to create jobs for them? No. If they don't have jobs, we're not trying to help them. But what we're doing today for the 40th time is to make sure they can't get health insurance. This is an obsession on the part of the Republicans. I was commenting on it the other day in committee, and I said it's such an opposition that the law has become the Republicans' great white whale. They'll stop at nothing to kill it. And so here we are, their 40th attempt to repeal the Affordable Care Act. I think it's a disgrace. Is this all we have to do? Spend 40 separate times trying to repeal a law that is going to bring health care to millions of Americans who have been denied health care opportunities because of pre-existing conditions, because their employer doesn't provide it to them, because they otherwise couldn't afford it. It will give people in the middle class choices, and with competition between choices of health insurance, the prices will drop, the quality will improve. This whole health care bill was based on Republican ideas, including a requirement that everybody get health insurance. That was endorsed by the Heritage Foundation. So I'm astounded that we're back here today. The last thing we're going to do before we go take our recess, our vacation, and go home and tell people, sorry, we can't help you. We're trying again in the House of Representatives to repeal one bill that has been passed that can mean so much to so many. I urge that we defeat this legislation. Yield back the balance of my time.
Time of the gentleman has expired. The gentleman from Georgia.
Reserve.
The gentleman reserves his time. The gentleman from Michigan.
I now yield a minute to the gentleman from Washington, who is the ranking member on the Health Subcommittee of our committee.
The gentleman from Washington is recognized for 1 minute.
I ask you to dispense.
Without objection, so ordered.
Mr. Speaker, as I listened to Mr. Waxman, it's clear he was talking about obsession. And you might ask, well, why is this happening here and what's going on? This has happened before. This is the worst nightmare for the Republican Party. In 1964, the American Medical Association was flat out against the institution of Medicare. When I was in medical school, they came up to medical school, the president said, boys, there isn't going to be any medicine in this country. We're having that socialized medicine come in. It's a terrible thing. It's a world. And you know what happened? They made the people so afraid that when they went out to enroll people in Medicare, people said, well, I don't want any of that government medicine in my house. Look at Medicare today. Nobody on that side would dare take out Medicare because the American people found out that what they were told in the advertising campaign leading up to it was not true. And that's what you're getting here today. Untruths. Vote no on this.
Fired. Gentleman from Georgia.
Thank you, Mr. Speaker. I ask unanimous consent that a letter from 15 or 16 organizations from around the country endorsing 2009 be inserted into the record.
Without objection, it will be part of the record. The gentleman from Michigan.
Reserves.
Would you tell us how much time we have on both sides?
The gentleman from Michigan has 2 minutes remaining, and the gentleman from Georgia has 14 minutes remaining.
Mr. Price, are you ready to close?
I'm prepared to close.
Okay,
Yes, sir.
I'm now going to yield one of our 2 minutes to Mr. Andrews.
The gentleman from New Jersey is recognized for 1 minute.
I ask unanimous consent to revise and extend.
Without objection, so ordered.
Mr. Speaker, thank you. I've sat and listened to the debate this morning and heard a lot of the slogans that we hear on this repeated again and again and again, and I would simply return to the point that I made earlier. For a family that makes $40,000 a year, has 2 adults working, 2 children, that doesn't get coverage at work, which is true for many, many Americans, maybe 35 million Americans have a situation something like that. The Affordable Care Act says that starting January 1st, for about $40 a week, they can buy health insurance from a private insurance company as good as the members of Congress have. What is the plan from the other side since they're repealing this? This bill takes that away. What is the plan from the other side to provide for that family? Now, they'll talk about bills they've introduced and letters they've written. There's not been one bill, one vote, one day that would answer that question. We eagerly await, after 1,000 days of the Republican majority, the American people eagerly await that answer. I yield back.
Time of the gentleman has expired. The gentleman from Michigan.
I yield myself the balance of our time.
The gentleman is recognized for 1 minute.
From the outset, I made clear my reaction to IRS mismanagement, called for relieving of duties of 2 people. But what the Republicans today are doing is using the IRS as a bootstrap to express their hatred of health care reform. I want to read this and challenge anybody to refute it. Assertions that the IRS will have access to personal health information is wrong, is deliberately misleading. The IRS will only receive routine information: name, address, family size, incomes, coverage status, needed to provide tax credits. That's it. The rest are falsehoods. I yield back the balance of my time.
Gentleman yields back his time. The gentleman from Georgia.
Thank you, Mr. Speaker. Again, it's important for folks to appreciate that the Republican goal in health care is to make certain that every single American has the highest quality health care. We simply believe it ought to be patient-centered health care, and my friends on the other side of the aisle talk about patient-centered health care, but what they support is Washington-centered health care, with Washington making decisions. We believe patients and families and doctors ought to be making medical decisions. Now, what have we heard in opposition to this piece of legislation today? We've heard that Republicans have no plan. Well, on the contrary, Mr. Speaker, we have multiple pieces of legislation. I, in fact, have H.R. 2300 that is a patient-centered bill that makes certain that everybody has affordable coverage, that they are able to have the financial feasibility to purchase the coverage that they want, not that the government forces them to buy. That portability is solved, that you don't lose your insurance if you change your job or you lose your job, that we solve the whole challenge of pre-existing illnesses and injuries, but in a patient-centered way, not a way that the government forces you to purchase what they want you to purchase, and it would provide insurance for every single American. Second, we're heard this isn't a responsible piece of legislation. Mr. Speaker, let me suggest that the American people think this is a responsible piece of legislation, where over 80% don't think the IRS ought to have a thing to do with their health care. We've heard that this bill isn't going anywhere at all, that why do it? It's a futile attempt. Well, I'll remind my colleagues on 7 pieces of legislation, bills passed in this House, bills passed by the United States Senate and signed into law by President Obama that either repealed or defunded portions of his own health care law. H.R. 4 repealed the small business paperwork mandate. H.R. 1473 cut $2.2 billion from the stealth public plan and froze the IRS budget. H.R. 674 saved taxpayers $13 billion by adjusting eligibility for Obamacare programs. H.R. 2055 made more reductions to the Independent Payment Advisory Board in the IRS. H.R. 3630 slashed billions of dollars from Obamacare slush funds. H.R. 4348 saved another $670 million from the boondoggle, the Louisiana Purchase, that was included in the original bill. And H.R. 8, which repealed the unsustainable class program. All of those repealed or changed portions of the Affordable Care Act signed into law by the President of the United States. We've heard heart-wrenching stories from our friends on the other side about health challenges and illnesses. And yes, Mr. Speaker, there are real challenges out there. As a physician, I can attest to that, having spent over 20 years taking care of patients. But the American people don't want Washington deciding what kind of health care they must have or can have. We need patients and families and doctors making those medical decisions. And then the preposterous assertion from the other side that Republicans don't like affordable care, quality care, accessible care. Nonsense, Mr. Speaker. Nonsense. What we want is the highest quality of care that respects the principles of affordability and accessibility and quality and choices and responsiveness and innovation. We simply want patients and families and doctors to be in charge of health care, not Washington, D.C., and not the IRS. I urge support of H.R. 2009 and yield back the balance of my time.
The gentleman yields back his time. All time for debate has expired. Pursuant to House Resolution 322, the previous question is ordered. The question is on engrossment in third reading of the bill. As many as are in favor will signify by saying aye. Those opposed will say no. The opinion of the chair, the ayes have it. The ayes have it. Third reading.
A bill to prohibit the Secretary of the Treasury from enforcing the Patient Protection and Affordable Care Act and the Healthcare and Education Reconciliation Act of 2010.
For what purpose does the gentleman from Minnesota rise?
Mr. Speaker, I have a motion to recommit at the desk.
Is the gentleman opposed to the bill?
I am opposed.
The gentleman
motion to recommit.
A point of order is reserved. The gentleman qualifies. The clerk will report the motion.
Mr. Nolan of Minnesota moves to recommit the bill H.R. 2009 to the Committee on Ways and Means with instructions to report the same back to the House forthwith with the following amendment. Section 4, protecting middle-class families and small business from tax increases. Nothing in this act shall be construed to alter, impact, delay, or weaken 1. Section 1401 of the Patient Protection and Affordable Care Act that provides tax credits for middle-class families earning up to $94,200 for a family of 4 for the purchase of health insurance coverage and exchanges, and 2, Section 1421 of the Patient Protection and Affordable Care Act that provides tax credits to small businesses up to 50% of the cost of coverage for 2 years beginning in 2014, up to 35% for prior years, for the purchase of health insurance coverage for employees.
The gentleman from Minnesota is recognized for 5 minutes on his motion to recommit.
Thank you, Mr. Speaker. My final amendment would protect important tax credits and tax breaks for middle-income families and for small businesses. It will not kill or send this bill back to committee. Will allow us to proceed with final passage should it pass. And now to the heart of what this is really all about. I thought our colleague Mike Thompson here a few minutes ago from California characterized it quite well when he said this should be called the 40th waste of taxpayers' time and money act, not an alternative to the Affordable Care Act. The fact is that the Republican opposition here is engaged in their 40th political attempt to undo the Affordable Care Act and offering us no alternatives to the time when 46 million Americans had no insurance, when health care and insurance rates were rising at a rate of 20% per year. Mr. Speaker, my colleagues, no is not a plan. No is not an answer. President Harry Truman was fond of saying, and forgive me for quoting him directly, but he used to like to say, any jackass can tear down a barn, but it takes a carpenter to build one. And I'm challenging my colleagues, are you here to tear down the barn, or are you here to build one? Mr. Speaker,
I feel compelled to ask, are you really serious when you come before us here and you say you really, truly want to increase taxes on families and small businesses as this bill would do? Are you really serious when you say you want to take away from students the right to stay on their parents' insurance policy? Well, they're trying and struggling with the difficulties of increased cost of education. The American people don't want that. What is your plan? Mr. Speaker, are you really serious when you say you want to deny people with pre-existing conditions the right to have health insurance? The American public don't want that. What is your plan? Are you really serious when you want to continue this de facto notion that women somehow, by definition, are living with pre-existing conditions and charge more for the exact same policies as men would pay for? The American people are not. What is your plan? Mr. Speaker, I ask my colleagues, are you really serious when you want to vote to eliminate free prevention care, which saves lives, which helps save cost in our medical system? The American people are not. You know, what is your plan? Mr. Speaker, I ask my colleagues, are you really serious when you say you wanted to remove the cap on insurance companies' liabilities? The very cap that forces people with serious accidents and illnesses into bankruptcy? The American people don't want that. What is your plan? And last but not least, Mr. Speaker, are you prepared to vote to deny senior citizens the relief from the increased cost in pharmaceuticals as a result of that donut hole? The seniors in this country are not. Again, I ask you, what is your plan? Mr. Speaker, that's what's at heart here. We have had 40 attempts to repeal this bill, and we haven't seen one single plan offered forward here. This is a waste of time. Let us get serious. Let us start to show some bipartisanship, and let's start with it here today by passing my amendment. Mr. Speaker, it's no secret. The public has weighed in on this. This Congress is acknowledged by all parties and all spectrums as the most unproductive Congress in the history of this country. That's shameful. Polls show us 25 points behind cockroaches in popularity, 23 percentage points behind, what was the last one? Oh, root canals. We're just slightly ahead of Genghis Khan and the Communist Party in popularity. It's time that we put an end to this nonsense, put this Congress to work, postpone, cancel this recess. Let's put an end to this nonsense, get America working again, and get this country moving again. Thank you.
Time of the gentleman has expired. For what purpose does the gentleman from Michigan seek recognition?
Mr. Speaker, I withdraw my point of order and seek time in opposition to the motion.
The point of order is withdrawn. The gentleman is recognized. Does the gentleman rise in opposition to the motion to recommit?
I do.
The gentleman is recognized for 5 minutes.
I yield myself such time as I may consume. I would just say that, Mr. Speaker, there's nothing in this bill that prevents middle-class families or individuals from receiving subsidies to which they're entitled to. So I think it's just important to understand what the facts are, but what we want to do is keep the IRS out of control of your health care. Talk about unpopular items. Look, businesses have gotten a waiver from the mandate. 1,300 organizations, businesses, unions have gotten waivers from this law. What about individuals? What about American families? If you want to keep the IRS out of control of your health care, vote no on this motion to recommit. I yield back.
The gentleman yields back his time without objection. The previous question is offered on the motion to recommit. The question is on the motion to recommit. As many as are in favor will signify by saying aye. Those opposed will say no. Opinion of the chair, the ayes have it.
Speaker, I ask for a recorded vote.
Recorded vote has been requested. Those in favor of request for a recorded vote will rise and be counted. A sufficient number having arisen, a recorded vote is ordered. Members record their vote by electronic device. Pursuant to Clause 9 of Rule 20, the chair will reduce to 5 minutes the minimum time for any electronic vote on the question of passage. This is a 15-minute vote. On this vote, the yeas are 186, the nays are 230, and the motion to recommit is not agreed to. The question is on passage of the bill. As many as are in favor will signify by saying aye. Those opposed will say no. In the opinion of the chair, the ayes have it.
Ask for a recorded vote.
Recorded vote is requested. Those in favor of recorded vote will rise and be counted. A sufficient number having arisen, recorded vote is ordered. Members record their vote by electronic device. This is a 5-minute vote. On this vote, the yeas are 232, the nays are 185. The bill is passed, and without objection, the motion to reconsider is laid upon the table. You ready?
Work on it.